Welcome to social work exam prep, where I feel like it's self-explanatory, where we prep you for your social work exam. So today's question is a medication question. There's some substance use in there that you would probably want to understand, but it's predominantly a medication question. So let's get into it. All right. So. Start with the question for the day. Which of the following medications is used to treat alcoholism by making clients feel ill if they drink after taking it? A. Clozaril. B. Effexor. C. Antabuse. Or D. Topamax. All right, so the correct answer is C, Antabuse. So we discovered that the correct answer is Antabuse, but what is Antabuse? So this medication is used to treat alcohol dependency. It causes a negative body response by feeling ill when the person who is taking the medication also then drinks alcohol while they are on it. What the medication effectively does is it inhibits an enzyme in your body, aldehyde dehydrogenase, which then leads to the accumulation of acetaldehyde, which then causes the actually very unpleasant and uncomfortable response. So that was like the scientific method of what the medication does, the mechanism behind it. As for the other medications that were listed on there, let's dive into what some of those are. Clozaril, which is also known as clozapine, and I'm sure that's what most people recognize the name from. Clozapine, Clozaril is the brand name. It's an atypical antipsychotic that's used to treat schizophrenia and other psychotic disorders. It works by balancing the neurotransmitters in your brain, the dopamine and the serotonin, that help with regulating mood and being able to stabilize somebody that is having issues with psychosis or a psychotic disorder. Topamax, also known as topiramate, Topamax is the brand name, topiramate is the generic name or the drug name, is an anticonvulsant medication, actually, and it's used to treat epilepsy and also to prevent migraines. So it is a migraine medication that's often used as well. I also know it to be used in weight loss clinics. It has a side effect, a part of the medication that helps with lessening or curbing one's appetite. And oftentimes when that appetite suppressant kicks in, that helps with quieting the food noise, which allows people to then take a step back, think about the choices they're making with their food or their calorie intake, as opposed to that food noise being on constantly and feeling like you're always hungry and always needing to eat. So that is something that is used in weight loss clinics and weight management. Effexor was the other medication that's on there, also known as venlafaxine. Effexor, the brand name. Venlafaxine is the generic or drug name. That is an antidepressant in a class of medication called SNRIs, serotonin norepinephrine reuptake inhibitors. So it's in a similar class as SSRIs. This is just kind of combining the S from SSRIs, or one of them, with the norepinephrine. The mechanism behind this medication is that it helps to restore natural balance of neurotransmitters, specifically serotonin and norepinephrine, the two that are named in the actual title of the drug, in the brain. It increases the level of those neurotransmitters by blocking their reabsorption into the nerve cells, which allows for them to just kind of free flow, as it were, and that helps to improve the mood overall. So, to give you kind of a visual example, if this is the nerve cell and these are the neurotransmitters, when you are having issues generally with mood and depression, it is because the nerve cells in your brain are reabsorbing all the happy hormones that are in your brain, the happy neurotransmitters. So by taking this medication, instead of it opening up like Pac-Man and taking all of those in, they stay closed essentially, and those happy hormones, those neurotransmitters get to stay free-flowing in your brain, which helps to, which allows for the brain to get what it needs and to improve your mood overall. So that helps to lessen depression, that helps to increase the positive mood aspects, and it helps to lessen anxiety. So while Effexor is considered an antidepressant, in modern day psychiatry, it is used to help with treating anxiety just as much. However, for the test, if they ask you what class of medication Effexor is, please remember that it is an antidepressant, not an anti-anxiety medication. Even though it is used to treat anxiety, it is truly an antidepressant. As always, thanks for coming by. Be back again soon with another question. We'll go over another practice question. We'll go over the answers. We'll kind of dive a little deeper into why the correct answer is correct and the wrong answers are wrong. See you next time on Social Work Exam Prep.